Hello again and welcome to The World Today. I am Amarachi Ubani. Let's begin today's program with the new protocol set by the United States for health workers returning to the country after treating patients in West Africa of Ebola. Well, the U.S. government says they will not be placed in quarantines anymore, but they will, however, be actively monitored under new U.S. health rules. This comes after a nurse was put in isolation in a tent in New Jersey, a decision condemned by UN Secretary General Mr. Ban Ki-moon. In the meantime, Australia has been criticized for imposing a visa ban on people coming from West Africa.
The government has strong controls for the entry of persons to Australia under our immigration program from West Africa. These measures include, Madam Speaker, temporarily suspending our immigration program, including our humanitarian program, from EBV-affected countries, and this means we are not processing any application from these affected countries.
As fears of the Ebola virus disease continues to spread throughout the world, Australia has stopped processing humanitarian and immigration visas from West African nations affected by the Ebola outbreak. This move is to prevent the disease from reaching the country. Australia has not recorded a case of Ebola, but has had a number of scares, including an 18-year-old West African woman who tested negative on Monday. Australia has contributed 18 million Australian dollars to help fight the disease, but has been criticized by some medical groups and opposition lawmakers for not sending teams to affected regions. In the meantime, the policy of mandatory quarantine is fully in debate in the United States.
If we don't get control of Ebola in West Africa, our problem in the U.S. will be longer, so that the more we make it disadvantageous for healthcare workers to go over there and help, the longer our problem will last.
The case of Ms. Cassie Hickox put into quarantine on Friday, October the 24th under a New Jersey policy that exceeded precautions adopted by the U.S. government underscored the dilemma that federal and state officials are facing. 4 people have been diagnosed with Ebola in the United States, but the only patient now being treated for the disease is a New York doctor, Chris Spencer, who was diagnosed last Thursday. He had worked with Doctors Without Borders, treating Ebola patients in Guinea. The states of New York, New Jersey, and Illinois have announced that people arriving after contact with Ebola patients in West Africa will be quarantined for the 21-day incubation period of the disease. Nearly 5,000 people have died in Sierra Leone, Guinea, and Liberia during the worst outbreak of the hemorrhagic fever on record.
In the meantime, the United States military has already provided hundreds of troops to help fight the spread of the Ebola virus disease in West Africa. This week, another 22 are leaving their families and friends in Maryland to join that fight. VOA's Pentagon correspondent Carla Babb attended their departure at Aberdeen Proving Grounds, and she found a young group eager to make a difference in this part of the world.
Forward march.
Soldier scientist. That's what members of the Army's 1st Area Medical Laboratory Unit like to call themselves. Their commander, Colonel Patrick Garman, says his team is trained and ready for Liberia.
We have a lot of young soldiers. This might be their first deployment. They're very excited. I think they feel confident in their abilities, and they really want to get over there and show what they can do and help the situation.
That's why I joined the Army. Andy Cahoon is a medical lab specialist for the Army who says she's always wanted the chance to do humanitarian work. But she says leaving her family to fight a deadly disease will be hard.
My mom is slightly worried, just like a mother should be, but more than that, I think she's proud of me, and I really thank her for all of her support.
Some of the unit will work in Monrovia, while other 3-person teams will work in mobile laboratories set up across Liberia. The unit will not work directly with infected Liberians, but they will have to wear full protective gear, because the samples taken of local Liberians still could contain the disease. Back in Maryland, Colonel Garman's family treasures their last days together before his deployment and hopes his return will come as soon as possible.
Everybody always hopes for sooner. If they come home early, it'll be a great celebration. If they don't, we know it's for a year. So it's just a mindset. mindset.
They hope to pass the days apart with frequent Skype conversations.
Modern technology has wonders in ways.
Because they say the mission of stopping Ebola is worth the sacrifice.
Today, the colors serve as a binding symbol of continuity.
The unit's colors, encased during the departure ceremony, will not see the light of day until the team lands in Monrovia. 2 of the soldiers leave Wednesday, while the other 20 will deploy for West Africa on Saturday morning.
Marching on to do good work here in Africa. And now as the fight continues against the Ebola virus disease, the World Bank has made an emotional appeal for thousands of medical workers to volunteer and to help contain the growing Ebola outbreak. President of the World Bank, Jim Yong Kim, said at least 5,000 medics and support staff are needed to beat the disease. He added that many potential volunteers are too scared to travel to West Africa, and that's quite understandable because the current outbreak here has been recorded as 10,000 people, with 5,000 people nearly killed, with nearly 5,000 people killed as a result of the virus. But the World Health Organization says 82 people are being monitored by health workers in Mali after a 2-year-old girl died of the virus last week. The WHO has deployed 3 of its officials into the country to test its Ebola preparedness, and 5 more will be arriving soon. Mali is the 6th West African country to report a case of the disease. Health officials are trying to contain the virus before it spreads any further. It's already killed, as we said earlier, 5,000 people. Most of these death toll is found in Liberia, in Sierra Leone, and also in Guinea. When we come back after the break on The World Today, some politics here in Nigeria. Defections continue as the Speaker of the House of Representatives makes a move to the All Progressives Congress. We have details on that. Please join us again.